Today we are going to demonstrate the assessment of the female and male genitalia, anus, rectum, and prostate. The purpose is to evaluate the student's performance on the use of correct techniques in performing a thorough physical assessment and to differentiate normal from abnormal findings of the female and male genitalia, including anus, rectum, and prostate. The materials needed are stool, a gown, disposable gloves, flashlight or pen light for possible trans illumination, stethoscope for possible auscultation, light source, speculum, Sergiu or water-soluble lubricant, test tube with water, MSC basin with warm tap water, and iris spatula. The first thing to do is perform hand washing. Gather all the materials needed, provided I have already gathered the materials. Explain the procedure to the client and ask the client to put on a gown.
Inspect the base of the penis and pubic hair for growth pattern and excoriation, erythema, or infestations. Inspect the skin of the shaft for rashes, lesions, or lumps. Palpate the shaft for hardened areas or areas of tenderness. Inspect the foreskin for color, location, and integrity. Inspect the glands for size, shape, lesions, or redness, and location of the urinary meatus on the glands. If uncircumcised, ask him to retract his foreskin to allow for observation. Palpate for urethral discharge by gently squeezing the glands between the index finger and the thumb. Inspect the size, shape, and position of penis. Penis is held out of the way. Observe for swelling, lumps, and bulges. Inspect the skin for color, integrity, and the presence of lesions or rashes. Spread out the scrotal folds of the skin to perform an accurate inspection. Lift the sac to inspect the posterior skin. Palpate the scrotal contents between your thumb and first two fingers. Note for size, shape, consistency, and presence of tenderness or nodules. Palpate each spermatic cord and vas deferens, noting nodules, swelling, and tenderness. Trans-illuminate the scrotal contents if a mass or swelling was noted. Look for a red glow. Inspect for inguinal and femoral hernia, watching for bulges while the client bears down. Palpate inguinal area, observing for bulges and masses. Have the client shift weight to the left to palpate for the right inguinal canal. Place index finger into the right scrotum and press upward to the slit-like opening of the external inguinal ring. With finger in canal or external inguinal ring, ask him to bear down or cuff, and then repeat for left side. Inspect and palpate for scrotal hernia if a mass was detected during inspection or palpation on the scrotum. Ask the client to lie down and note whether the bulge disappears. If it remains, auscultate it for bowel sounds. Then gently palpate the mass and try to push it up into the abdomen unless it is too tender. For anus and perineal area, inspect for lumps, ulcers, lesions, rashes, redness, and note for the size, shape, location, distribution, and configuration. Inspect sacrococcygeal area for swelling, redness, dimpling, or presence of hair in pilonidal area. Inspect for rectal prolapse with Valsalva maneuver. Palpate for anal sphincter tone, tenderness, nodules, or hardness. For rectum and prostate, palpate for the rectal mucosa for tenderness, irregularities, nodules, and hardness. Palpate for peritoneal cavity for tenderness or nodules or rectal shelf. Palpate the prostate gland for tenderness, size, shape, texture, or irregularities. Inspect the feces for blood and perform occult blood tests. For female genitalia, inspect the mons pubis, note pubic hair distribution and signs of infection. Inspect the labia majora and perineum. Note for swellings, lesions, and excoriation. Inspect the labia minora, the clitoris, urethral meatus, and vaginal opening. Note for lesions, excoriation, swelling, and discharge. Palpate the Bartholin's glands if history of swelling or current swelling is noted. Note for swelling, tenderness, and discharge. Palpate the urethra if client complains urethral symptoms or urethritis or inflammation of skin glands is suspected by inserting glove index finger into the superior portion of the vagina and milking the urethra from the inside, pushing up and out. Observe for drainage. For internal genitalia, inspect the size of the vaginal opening and the angle of the vagina by moistening the glove index finger with warm water and gently inserting the finger into the vagina. Assess the vaginal musculature by keeping index finger inserted in the vaginal opening and asking the client to squeeze around your finger. Using middle and index fingers to separate the labia minora, ask the client to bear down. Observe for bulging or discharge of urine. Perform speculum examination. Inspect the cervix for color, size, position, surface, discharge or lesions. Obtain specimen for the pap smear and if indicated, cultures to test for STIs or sexually transmitted infections. Inspect the vagina, unlocking the speculum and inspecting the vagina as the partially open speculum is slowly rotated and removed. Note for color, surface, consistency, and discharge. Perform bimanual examination by placing non-dominant hand on lower abdomen and inserting the glove lubricated index and middle fingers into vaginal opening. Applying pressure to the posterior wall and waiting for the opening to relax. Palpate the ovaries by sliding your intravaginal fingers to the right lateral fornix and attempting to palpate the left and then the right ovaries. Note size, shape, consistency, mobility, and tenderness. Observe for secretions as fingers withdraw. Perform retrovaginal examination by changing gloves on dominant hand and lubricating index and middle fingers. Ask the client to bear down. Insert index finger into the vagina and middle finger into the rectum. While pushing down on the abdominal wall with the other hand, palpate the internal reproductive structures through the anterior rectal wall with attention to the area behind the cervix. The retrovaginal septum the cul-de-sac, and the posterior uterine wall. For anus and perineal area, inspect for lumps, ulcers, lesions, rashes, redness, noting for the size, shape, location, distribution, and configuration. Inspect sacrococcygeal area for swelling, redness, dimpling, or presence of hair in pilonidal area. Inspect for rectal prolapse with Valsalva maneuver. Palpate for anal sphincter tone, tenderness, nodules, or hardness. For the rectum, palpate for the rectal mucosa for tenderness, irregularities, nodules, and hardness. Palpate peritoneal cavity for tenderness or nodules or rectal shelf. Inspect the feces for blood and perform occult blood tests. Perform hand hygiene. Validate and document findings.